What exactly is moderate scoliosis? Hey, Dr. Chris Goobles here from Square One Health, and today I want to talk to you about moderate scoliosis. So, as a quick review, how we measure scoliosis is by something known as a Cobb angle. Basically, when you're looking at a curve in the spine, we would look at the lowest vertebrae, that's the most tilted, and the upper vertebrae that's most tilted, and you would draw lines that intersect. And from those, we form an angle. That is known as a Cobb angle. So when we're measuring the severity of a scoliosis, we're talking about something called a Cobb angle. Now, from a previous video, whenever we have a curve that's between 10 and 25 degrees, that is considered a mild scoliosis. A moderate scoliosis is a scoliosis that's between about 25 and 40 degrees, and once we get beyond 45 degrees, that's what we call a severe scoliosis. There are many different types or causes of scoliosis. The most common cause or type of scoliosis is actually an idiopathic scoliosis. Now, the word idiopathic means no known cause. So about 80% of scoliosis in adolescence is an actual idiopathic scoliosis, meaning we don't know what's actually causing it. But we really understand once these curves start how they progress. Other potential causes of scoliosis in adolescence could be things like a neuromuscular scoliosis. Now, a neuromuscular scoliosis could be something like cerebral palsy, which is actually when there is a problem with the formation or development of the brain during child pregnancy. Or another common one is muscular dystrophy, where there's a problem in how the muscles form and the neuromuscular formation, and the muscles just can't function properly, and they can over time degrade. Another common cause is what's known as a congenital scoliosis. Now, in a congenital scoliosis, there's two things that we most frequently see. One of those is when we have a malformed vertebrae where you may have a wedge-shaped vertebrae. Another common congenital deformity is what's known as block deformity, where you may have several vertebrae that fuse together on one side, and a lot of times that will actually put a curve in the spine. So those are the more common non-idiopathic types of scoliosis we see in adolescence. When we're looking at the likelihood of a scoliosis progressing, once something has become mild, meaning once it's hit like 25 to 40 degrees and someone is still in the earlier stages of growth, meaning like a risk or 1 or 2, meaning they have a lot of growth left, we know that the risk of progression dramatically increases. So once we get that threshold where we're no longer considered a mild and we're a moderate scoliosis, the risk of progression dramatically goes up. We also look at the age of skeletal maturity. So the bigger that curve is and the more time of skeletal maturity left, meaning the more growth they have left, the higher risk of progression. We also know when we start getting curves over 30 degrees, even after skeletal maturity, there's an increased risk of curve progression. So a curve over 30 degrees after someone is done growing still has a mild risk, maybe a moderate risk of curve progression, even in adulthood. When that curve gets beyond 50 degrees, we know that there is basically 100% risk of that curve progressing. Beyond just the size of the curve, we also look at location, because curves in the lumbar spine or the thoracic lumbar spine also have a higher risk of progression, especially after someone is done growing. So what are some of the signs and symptoms we frequently see with someone with a moderate scoliosis? We're talking specifically now about adolescents. The most common signs, I would call these a sign because it's not something the patient actually feels, are physical appearance things that someone notices. They're going to start to notice bigger asymmetries. As the curves get bigger, these asymmetries become more prominent and more noticeable. So we look at things like asymmetrical shoulders, one shoulder being higher than the other. And when someone bends over, a possible rib humping in their mid-back. Some asymmetries in the waistline. If you have a curve in the lumbar spine, on the side of that curve, it's probably flat. You're going to see a bigger indentation on the side opposite of the curve. Possible shift in the trunk. If you have a curve in the lumbar spine, a lot of times they're going to shift towards the sides of that curve, and even uneven hips someone may notice. So the big thing is going to be asymmetry someone notices when they're looking in the mirror, maybe on pictures, and a lot of times it's not until these mild curves have become more moderate that they're actually caught or noticed by an adult. A lot of times when we have a mild scoliosis that's caught by possibly a pediatrician or a primary care doctor and parents told just to watch and wait, it's a lot of times when we start to notice these bigger asymmetries in the body when parents actually see the curve has progressed or gotten more severe. Now, in adolescence, pain, they do have pain. It's generally not a real high pain. It's usually more of a dull ache. And it's not something that becomes limiting, but pain does happen in adolescence. And generally, when we have moderate scoliosis, it does not become a problem that impacts cardiovascular or respiratory or other bodily functions. Now, we're talking about adults. Yes, a lot of times these asymmetries are there, but it's a lot of times in adults, pain becomes the big thing that drives treatment, and it's also a lot of times what may drive someone to notice they have a scoliosis, or they may become aware that a scoliosis that was smaller when they were younger is becoming more severe in adulthood. Now, when we think about what kind of tools we use to diagnose these, the first thing is X-rays is the gold standard. So when it's an adolescent, a lot of times they're referred to provider, which will do a physical exam. They'll notice some obvious asymmetries. One of the simple screening tests that should be done is an Adams forward bending test, where you put their hands together and you have them bend forward, and you use what's called a scoliometer, and you're actually measuring for an amount of rotation. When that gets beyond basically 5 degrees in the lumbar spine or 6 or 7 thoracic, that's a positive finding indicating, yes, there's actually scoliosis. The scoliosis is confirmed, and the severity of the scoliosis is confirmed on X-rays. That's the gold standard. Some other diagnostic tests that can be done on a really severe case, a CT scan may be ordered so the providers can get a 3D image of how severe the actual spine deformity is, because scoliosis is a spine deformity, meaning the spine grows asymmetrically. It's not simply a lateral bending and twisting. It's the vertebrae and disc are actually growing asymmetrically. And if someone is having neurological symptoms with that, signs and symptoms, possibly loss of reflexes, numbness, tingling, or something that could indicate a possible bigger pathology, that's when an MRI would be warranted. Also in adults, an MRI may be warranted to look for any stenosis or narrowing of the openings where the vertebral nerves come out, or actual narrowing of the canal that the spinal cord and spinal nerves runs down in the spine. So when we look at the risk of progression in adolescence, probably the biggest thing is how much more growth do they have and how big is that curve. Bigger curves with a lot of growth have a very high risk of progression. The smaller the curve with less growth means there's less likely risk of progression. In adults, moderate risk of progression with curves over 30 degrees, but also if that curve is in the thoracolumbar or the lumbar spine, those curves are more likely to progress in adulthood. Curve over 50 degrees is pretty much guaranteed to progress over adulthood, but once we hit adulthood, the curves do not progress as fast as they do that first year or two of adolescence during puberty. So what are the appropriate treatment options for someone with a moderate scoliosis? So first thing, if someone has a moderate scoliosis, or if you have an adolescent or teenager with moderate scoliosis and they still have growth left, they are beyond the point of observation. They need active treatment. For these curves in adolescents, combining scoliosis-specific exercises and custom bracing, that has the best overall result. In adults, the same thing is true. If an adult has a smaller curve and let's say 30 degrees and they're 40 years old and they have some pain, they could do scoliosis-specific exercises only, or they could wear a brace if they want, but they have options there. Once the curves get bigger, if something gets like 40 degrees, then a lot of times they're going to need bracing and likely scoliosis-specific exercises too. Now, I mentioned bracing. I need to clarify the difference between a traditional brace that's frequently prescribed for scoliosis. A lot of times at orthopedic centers or hospitals, they use a brace that's not custom to the individual, and they use something called 3-point pressure system. Basically, what they're trying to do using those kind of braces is squeeze the spine, and they want to hold the spine in place with the goal of keeping it from becoming a surgical case. What we do with the Scoli brace is different. Scoli brace uses a 3D overcorrected method. And basically we're taking the patient's spine and we're putting it in an opposite position. And what we're doing is we're reversing the forces of the vertebrae so we can reverse how the spine has been growing. Because when you have a scoliosis, you have part of the vertebrae and disc that are not growing as fast and part of those that are growing faster. We want to reverse those so we can actually influence and change how the spine grows and help the spine grow more symmetrical over time. When we look at exercises, things like general physical therapy are not real effective in slowing the progression of scoliosis, and they definitely can't do anything to reduce the size of scoliosis. You have to do scoliosis-specific exercises, things like Schroth, things like C, scientific exercise approach to scoliosis, and things like chiropractic biophysics. More recently, a more modern and more effective and efficient technique known as Scoli balance has taken the best parts from Schroth and C's and chiropractic biophysics and has combined those to make a method that's very easy for the patient to do and also easy for the provider to implement. So let me show you a case study of a 13-year-old female patient that presented to a Scoli brace center Scoli care clinic. Now this patient had a 33-degree thoracolumbar scoliosis, and she was prescribed a custom scoliosis brace and scoliosis-specific exercises. She wore her brace full-time for the first 17 months. Full-time means anywhere from 20 to 23 hours, and she wore her brace part-time for the last 17 months. Part-time is generally anywhere from 10 to 12 up to maybe 18 hours a day. She also did scoliosis-specific exercises. At the end of her treatment, her curve had reduced from 33 degrees down to just 10 degrees, and she was stable long-term with that improvement. This is a perfect example of when we want to be able to first see a patient and the right treatments getting the best results. The big thing you need to know is the earlier the treatments are done, the better the outcome. So it's really critical to catch these early. One of the things we do to catch these is proper screenings. Now all girls should be screened at the ages of 10 and again at the ages of 12 for scoliosis. And boys should be screened for scoliosis between the ages of 13 to 14. So because if we catch these curves earlier, we can get better long-term outcomes. Because all big curves start as small curves. I hope you find this information useful, and if you know someone, especially an adolescent, that has scoliosis that's been detected, make sure you get them to an expert at treating scoliosis and find someone that has real high-level expertise and education in the best non-surgical treatment options. Because when someone has a moderate scoliosis, the number one goal is to prevent surgery. But we also like to improve aesthetics and appearance and keep this curve from becoming a bigger curve after growth.
So if you're finding this information useful, like, follow, or subscribe, and share with others you think would benefit from this information. And if you have scoliosis or you have a child that has scoliosis, don't hesitate to reach out. Just give our office a call and ask for a free consultation to see if there's something we can do to help you.